You're doing that, I think. Yeah. We're just trying to work on the webcam.
And if it doesn't work, don't worry about it. You can just go ahead and start.
Yeah, that's what I think we're going to do. I prefer that anyway.
Yeah.
All right. Good morning, everyone. The title of this presentation today is Caregiving During COVID-19, Familial Experiences Managing Dementia. My name is Mary Nemec, and I thank you all for attending this presentation today. I have my master's in social work and worked at the Center for Aging Studies at UMBC from 2007 until 2019. I'm currently working at a continuing care retirement community in the Baltimore area, and I'm in the skilled long-term care unit. I'm also working part-time alongside Dr. Laura Gerling, who is an assistant professor at Towson University. There are no disclosures to report. I would like to thank the National Institute on Aging for funding our work, and a warm thank you also to the participants in this grant for contributing their time and stories. Before I begin, I just wanted to share that I was the interviewer on this particular case study. We interviewed 47 people throughout the course of the project during COVID. So it was extremely challenging. Ethnography was no longer being utilized. We had to do all of the interviews via telephone, and we had a $50 honorarium that we shared or thanked our participants or the caregivers. And we had to go through all kinds of hoops to get that money delivered to them safely. So this particular case study that I'm going to work on or tell you about is actually, I was the interviewer in that case. As COVID-19 continues, it puts exceptional burden on at-risk vulnerable populations, including people with dementia and their informal support systems. As information on COVID-19 shifts, its impact on the care and well-being of these vulnerable populations is poorly understood. Accordingly, there is a critical public health need to understand how COVID-19 has impacted Americans with dementia as well as their informal care providers. 47 interviews for this grant focused on understanding the experiences of informal as well as formal caregivers during the COVID-19 pandemic. The team was especially interested in hearing from those who assisted persons with neurocognitive impairment. Topics included how social distancing impacted the execution and receipt or acceptance of informal care, as well as informal caregivers' perspectives on age discrimination. Researchers also looked at how social distancing impacted how the formal support system approached, treated, and prioritized community dementia. Data collection spanned from December 2020 to October 2022. Since ethnography was not able to be conducted due to the strict COVID rules in place, recruiting for this study was extremely challenging and had significant impact on the scheduling of all of these interviews. Interviews were conducted via telephone, and delivery of the honorarium had to be cautiously and strategically carried out, utilizing the strict safety protocol that was still in place at the time. Data were collected and drawn from a minimal risk National Institute on Aging funded study that focused on understanding the experiences of dementia caregivers during the COVID-19 pandemic. The grant, official title, Aging at Home with Alzheimer's and Related Dementias, Caregiving During COVID-19, was NIH funded. As stated earlier, 47 phone interviews were conducted with caregivers. They were both formal and informal, who provided care to community dwelling persons with dementia. In addition to the digitally recorded interviews, in-depth field notes, bioform information, and a detailed strategic document were all collected. The interviews averaged 92 minutes, and each participant received a $50 cash honorarium for their valuable time. Sub-analyses included an initial scanning of data for pertinent topics. This analysis included listening and reading through all 47 transcripts. All names used here are pseudonyms. It was emphasized to all participants that their confidentiality was taken very seriously and that they would be given a de-identifying name as well as a de-identifying number. An in-depth review of transcript data of the 3 caregivers initially produced a Word document with key concepts, inspirational quotes, and thoughtful insights. Thematic findings were then devised from a more thorough and intensive review of the Word document. So this particular case study is involving the mother who was the person living at home with dementia and her 3 caregivers. 2 were family caregivers, 2 daughters, and the 3rd caregiver, which you'll meet later, was a family friend who then later became a paid caregiver. So at the time of my interviews, Lily was a 77-year-old native Hawaiian who was wheelchair bound due to several debilitating strokes. Although not able to walk, the family was thankful that Lily was at least able to talk and feed herself after being set up. Minimal assistance was needed at that time for the eating. Lily was 14 years old when she had her first daughter. Her 2 daughters and a family friend were the primary caregivers during COVID. More information will be presented on these particular caregivers. Lily's spouse had unexpectedly passed away, but the family utilized their parents' home in Anne Arundel County, Maryland, for a few days during the week. This allowed Lily to be comfortable in her own home, as well as protecting her from being exposed to COVID. This family was a very tight-knit group who gathered with their parents for holidays and special occasions throughout their lives. Lily's spouse was extremely involved in her caregiving until his untimely death, but the children were already heavily engaged in their mother's care at that time, so they were very familiar with the caregiving routine. Both daughters stressed the fact that they were a very holistic family and did not follow traditional diets or medicinal strategies. Ironically, both parents suffered from ailments that were the direct result of environmental factors. Prior to COVID, the family had utilized the services of a Catholic-based adult day service program that had been well received by both Lily and her family. The days spent at this adult day service program had allowed respite for the caregivers as well as stimulation for Lily. The family has noted both the physical toll that COVID-19's fallout has played on their mom, as well as the social isolation and cognitive decline that has occurred as well. Lily is planning to return to the adult day service program as soon as it reopens. She had gotten her first COVID vaccination at the time of this interview, and the plan was to receive any future boosters, even though it was against their holistic prior life. Most family members are electing at the point of the interview to decline the vaccine, noting that they were a very holistic family. However, both caregivers received the vaccine and worked hard to get their mom the vaccine as soon as it was eligible and able for them to get it. Both daughters, however, stressed that this decision was a tough one due to their holistic upbringing. So caregiver number 1, we'll call her Luann, explained that although there were 6 children, one sibling had recently passed away, she and her sister, who happened to be an occupational nurse, were the primary caregivers. The family had decided that they would be the best 2 and that they would be the only ones to receive the vaccine. This family lives season to season, which she eloquently explained was a mechanism that their family came up with during this caregiving journey. She stated, quote, So my life stopped on a phone call, literally a phone call, unquote. Her parents owned, and this is where she grew up, a small house with 3.5 acres. The family lovingly referred to this family home as Little Hawaii. The family banded together after their mother's initial stroke and provided round-the-clock care even while their mom was in rehab. She explained that their mother has never been alone in this entire process. The children took turns sleeping in hospitals, rehab centers, and even attending days with their mom at the adult day service program before COVID. An interesting fact is that her mother had Luann when she was just 14 years old, and by the age of 21, her mom had already had 6 kids. So the age difference between Luann, the daughter, and her mom is exactly 15 months. I'm sorry, no, 15 years. At the time of the interview, Luann was 63 and her mother Lily was 77. Luann took many times to let me know that she was not a young chicken and that caregiving had been a burden on her as well. Her mom had, again, 6 children. At the time of the interview, there were 20 grandchildren and 16 great-grandchildren. Most of Luann's siblings are in their 50s and 60s, thus making the physical aspects of caregiving quite challenging for all. She described that there was never an issue about who would do what for their mother. The siblings have worked tirelessly together to make this situation work. After 6 months in the hospital and then the rehab, defying all odds, their mom survived the first debilitating stroke and was only home for 2 or 3 days when she suffered yet another stroke. Although feeling completely challenged, the family had to repeat everything in their caregiving routine to get her through the second hospitalization and rehab of this second stroke. During the interview, her mom is now wheelchair bound and requires constant around-the-clock attention. But Luann feels grateful that her mom is still able to speak and again feed herself after setup. Whomever is staying with her mom changes her adult protective undergarments every 2 hours and repositions her as well. And this includes all through the night. Luann credits their caregiving knowledge to being watchful while they were in the hospital and rehab and having creative minds and loving hearts. She began the interview with the statement that the family has always felt the unconditional love from their mom, and this is something that they see as necessary, and so there's rarely any resentment among the siblings. The family has worked hard not to tap into the grandchildren's lives for assistance, but a wise caregiver has explained that to them, that as these siblings age, they may have to begin asking for help from their children, which is Lily's grandchildren. And Luann has recently understood that even in greater detail because of her aging bones and the COVID crisis. If whomever is caring for their mom needs a break or has some type of life event occurring, the family schedules a meeting and that caregiver gets relief. Every season, so 4 times a year, the current situation is reassessed and caregiving then looks a bit different for the next 4 months. This family is very unique, and although they did occasionally use outside resources, COVID-19 has significantly impacted their lives as well as the life of their mom. Luann's resiliency exuded throughout my interview with her. Obviously, her childhood was filled with unconditional love, and her parents served as strong role models. Her life motto is that, quote, "It's not what happens to you, but how you handle what happens to you." Caregiver number 2, Leilani is what we will go by today, is the second daughter who is committed to caring for her mother. She's an occupational nurse and was still working at a hospital during COVID when I interviewed her. It was actually only a few minutes into my interview with Leilani that I realized that she was the sister and other caregiver to Lily, although that was not disclosed in her interview. Although she never specifically mentioned this sister's participation in a relationship, I was excited to hear her perceptions and insights. They were very similar, although I was able to get greater detail about a few of the siblings. Both sisters mentioned that early on, after several unplanned events, the family decided to approach caregiving as a season. Both sisters mentioned that anyone can get through a certain time period, and seasons just happen to work for this family. That any time the caregiving became overwhelming, as stated earlier, or there was some change in the current caregiver's life situation, for instance, an illness, an injury, vacation planned, wedding of a child, the caregiver who was currently taking care of Lily could ask for assistance. Not once has there been any type of sibling argument or questions asked. Leilani specifically mentioned that there's a substance abuse issue with one of the brothers, but the family does not hold any ill feelings for the situation, and that brother has been able to assist in other ways. As mentioned prior, the mom still owns the family house, and it is settled upon 3 acres, so the brothers spend much of their time doing the physical upkeep, any type of maintenance that needs done, while the sisters have been the primary caregivers. Unfortunately, when COVID-19 hit, the caregiving arena got very small, and for many, many months, it truly was just the sisters and their spouses caring for Lily. The current schedule at the time of my interview was that the mom would stay at her own house on Monday and Tuesday, where a trusted family friend would take care of her, and then the older sister would take her on Wednesday and Thursday, while Leilani finishes out the week. Losing the respite of the adult day service program was a significant blow to the caregiving routine, but keeping their mom safe was always at the forefront of every decision surrounding COVID. There are 16 grandchildren, as mentioned prior, and many great-grandchildren, but they have not been able to interact at all during COVID-19. So when possible, the family will surely go back to big celebrations. During COVID-19, there were many drive-by celebrations where waves and blown kisses were shared. This was especially difficult for this family, as Leilana described them as a hugging family. This was also in 2021, the first and only year that Christmas was not celebrated with the extended family at the house that they call Little Hawaii. Both sisters ran an extremely tight ship and did not allow anyone in their respective homes. The mom has a condition called neurogenic bladder, so she has to be repositioned every 2 hours. The mom has limited mobility, but is able to reposition using assistance. The mom is also changed and repositioned at night. This proved to be challenging, and many lost hours of sleep for both of the daughters and the family friend. Also, both sisters stressed the fact that their mom had to be taken outside for 20 minutes every day in all elements, and everyone who was an active caregiver had to participate in this endeavor. That would entail, I was told that if it was raining, they used an umbrella. If it was snowing, they bundled up. Both sisters had also bragged to me that their mother had never been left alone throughout this entire ordeal. Apparently, the one time early in her recovery that her father could not be with her, she attempted to get out of the wheelchair and suffered a bad fall in the hospital. That was the last time that she was alone. From that moment, she had 24/7 care. Both sisters also remarked about the healthy lifestyle that their parents had lived, yet her mother had had a very rare type of stroke, and their father passed away from an extremely rare type of cancer that was linked to an environmental factor. COVID-19 completely turned their already chaotic world upside down, but this family remained very positive and proactive. Never once has anyone in the family questioned the fact that they would take care of their mother, who was extremely active in all of their lives. In fact, before her stroke, she would oftentimes drive her great-grandchildren to their various sports activities, and it would not be unusual for her to be hopping on a plane to visit someone in the family. Unfortunately, with the mother's stroke and declining cognitive abilities, all that has stopped. However, Leilani considers it an honor to share in the caregiving of her mom in this life journey, and many times would mention the fact that she was blessed to have support from other siblings. The third caregiver, who's a family friend, we will mention her, call her Maud, is a 61-year-old white, non-Hispanic friend of the family who spends 50 consecutive hours per week at Lily's home. At the time of the interview, she had been caring for Lily for 4.5 years. She has a master's degree and was retired from a call center where she served as a customer service representative. Initially, she volunteered as a family friend to take a shift or two at the rehabilitation center when Lily was first admitted for her stroke, but the family grew to rely on her assistance and decided to hire her as a private caregiver. Maud is currently divorced and lives alone. Maud relies on the family giving her strict guidelines as to the routine and caregiving roles. She was proud to share that some of her adaptations she has come up on her own in order to make the caregiving duties easier, but she always runs them by the two sisters. At the time of this interview, Maud has yet to be vaccinated because she was still waiting for her group to be eligible, so she was following extremely strict protocols. Maud knew that it would be mandated for her to be fully vaccinated, however, in order to continue caring for Lily. Thematic findings revealed 3 narrative themes: programming effects, innovative adaptations, and spirituality. So the closure of the adult day service programs and other in-person formal care options had a devastating impact on cognitive, emotional, and functional health of both the person with dementia as well as family. Loss of in-person resources triggered decline. This particular family was not very tech savvy, but the grandchildren were able to teach the others how to order things through Amazon, grocery shop with delivery or pickup, and communicate with other family members for special occasions or checking in through Zoom and other mechanisms. Caregivers, in trying to recreate the adult day service atmosphere, would take their mom along on fairly busy roads so that she could have a change of scenery, and they found that Lily reading off the signs as they were passing them maintained some of the cognition that they were seeing being lost. As stated earlier, Lily is taken outside for 20 minutes every day for fresh air and to enjoy nature. Luann, as we visited prior, told me that, quote, 10 minutes in the rain is like taking a trip to the beach for someone with dementia, unquote. Innovative adaptation. COVID forced creative and innovative solutions to dementia care, including socialization and structured support. The family developed this concept of season by season, whereby they distributed caregiving burden by division of the year. Breaking caregiving into 4-month segments for this family made even the toughest challenges manageable. This family was forced, like so many other families, to think outside of the box when COVID-19 became a long-term reality. This family learned from the very beginning that caring for their mother took support from the entire family. Everyone based their roles and their individual strengths. When COVID hit and safety became an issue, the family went into survival mode. One thing was certain: change is inevitable, and the constantly moving parts became quite overwhelming at times. The 2 daughters did not allow any visitors besides themselves during the height of COVID, and their spouses living in the house sometimes would even have to segregate themselves. Caregiving duties at that point shrunk to those 4 individuals. One daughter described the situation as a bubble. The adult day services that Lily attended utilized innovation to continue their services remotely. Daily calls were made where Lily, as well as family members, could speak to the social worker, nurse, or director. Zoom calls were eventually set up where entertainment, Bible study, chair exercises, trivia, and storytelling was offered. Care packages were delivered from the adult day, and support was available to Lily as well as her caregivers. The family attempted to recreate the adult day service program by quote unquote matching their actions. For example, if someone was on the computer, Lily would be given an iPad. If the caregiver on duty was on the phone, Lily would also be given a phone. If the caregiver was exercising, Lily would be given pedals on the floor to mimic a stationary bike, and small weights would also be provided. In this way, they were hoping to maintain the routine and normalcy for Lily in ways that they hoped would be beneficial. The paid caregiver, Maud, adapted all of Lily's clothes with a discreet zipper that made it easier to get clothes on and off. She explained to me that she labeled her innovative adaptation as a, quote, fashion modification, unquote. Spirituality. During time of crisis, the family unit felt comfortable in their spiritual beliefs and support from religious entities. They specifically located this adult day service before COVID based on their charitable religious organization. Spiritual community provided the family with guidance, support, and hope during extreme uncertainty caused by caregiving during the COVID pandemic. While spirituality was already an integral part of the family's core values, the family believed that having an adult service connection that was Christian-based made a huge difference for them. The daughters reported that while touring various communities in the beginning, this particular adult day service felt like home, and the spiritual component was immediately felt. The staff served as extended family. Throughout the interview, it was clear that the goal was to get Lily back to in-person activities when the family felt that her return post-COVID was safe to do, and that the particular community had everyone vaccinated. While all members of the public have been experiencing difficulties since the onset of COVID-19, health threats varied depending on social circumstances and vulnerabilities. Analyses indicate that persons with dementia and their caregivers are distinctly impacted by COVID-19 and face unique challenges. After hours upon hours of interviewing families with vulnerable adults, this particular case study was the epitome of resiliency. Losing critical in-home services was a debilitating factor for many families who had heavily relied on their loved ones either attending programs such as Adult Day or bringing contractual caregivers into their homes. Unfortunately, this unstable time during the pandemic resulted in many families reverting to institutionalization for family members or extremely high stress. This particular family, on the other hand, revealed how one could actually think outside of the box with resources and utilize the strength of their siblings and other family members to be able to safely care for their loved one in a familiar and comfortable environment, especially during this complicated and unstable time. This family is unique and definitely the exception in our research. Attunement to such issues are of special interest to community-level policymakers, health providers, and older adults themselves, requiring further attention. I thank everyone for your kind attention, and we'll take any questions or thoughts or comments about this particular amazing family and situation, or any other questions about our research.
If you have questions, you can put them in the chat. There's one question in the chat.
Okay.
Did your research identify any specific disparities amongst caregivers of minoritized groups?
So looking across the research, obviously that did have an impact. There were this particular family, although not they stated that they were not rich, they were able to pull from different resources because there's so many siblings. And again, some that could not really do caregiving were able to, contribute money for the various resources. There were other families that did not, unfortunately, have that. So, there were that's where, unfortunately, they ended up. Some of those had to go to an institution because the families, some of them had to work and they had no one to come in. Other families were trying to work at home with no resources. I can think of another family, and that particular caregiver had small children at home. So she was trying to take care of her father in that case, and also teach her children. So there were definitely disparities across the research. Yes, definitely sandwich caregivers. And that presented a whole other, challenge that we heard. So I do not know for this particular family if Lily ever made it back. I know that particular adult day service program did open back up. However, across the board in Maryland, in our geographic region, they're suffering. A lot of people did not come back. Some passed away. Unfortunately, some cognitively, were not able to rejoin and ended up in long-term care settings. And I know across the board, all of these programs are really suffering financially. There was some state money that was given to kind of keep them afloat, but they're not back to pre-COVID. Thank you for those questions.
There's one more question in the chat.
Okay. So social isolation was definitely a topic and a theme that came up, even in these families who had, for instance, Lily, she didn't quite understand why people couldn't come to visit her. She understood there was, a virus out there, but she couldn't quite understand it. Anything that we can see to combat this issue in the future. COVID was such a, scary time. I know some communities are now relaxing a little bit their visitation policies. I personally saw where family members, probably midway through COVID, they would beg and get outside visitation, and keeping the 6 feet apart. But so for me, it was still, they weren't able to hug or touch their loved ones, so that was still adding to the isolation. How do we get back to connecting our adults in their communities while staying safe? So again, I think the vaccine has definitely helped combat, although there are still some people who aren't vaccinated or who don't believe that we should be getting back to a little bit more lax. For the older population, the face mask just didn't seem to work. I asked about Lily, and she didn't quite understand how to keep that mask on. So that was a continual battle, which again, was another reason why they kept it so small. I think that there's still room for much more research into figuring out ways that we as policymakers can get to a place where there's not as strict of rules, but still able to keep everyone safe. So that's still going to be research that we need to continue in the future.
There are no other questions in the chat. Thank you, Mary. We really appreciate this presentation.
All right, Barbara, thank you so much.